Blossom Furtado.
Into your practice and you see like individual people, we have our different practices, but even with our practice we find that we cannot heal everybody. Now when I say incomplete understanding of the human body, I'm going towards incomplete understanding of what is healthy human nutrition that is still missing in the world today. Not a complete understanding of what are the internal mechanisms that are running the human body. Some of them are called homeostasis in medical terms. Also an incomplete understanding of how the human body expresses itself in different forms, physically, by getting sick, emotionally, energetically. And the reason we need to integrate modern healthcare, alternative healthcare, and the ancient healing sciences is because everybody has their own perspective of how this full human body works. And that is what I think we are come to do here. Give a holistic perspective from all these three dimensions so that each of us can share, educate each other and learn from each other.
Conscious, I will pay them 10,000 rupees. My wife read the aid and said, you are a neuroscientist, you don't believe in all these kinds of the devils and evils, please go and bring 10,000 for me. I went, he started narrating the stories, and the stories goes to, just 1 second.
Already sir, it has covered between the differences between the West and as well as the East. The only difference, what my perspective and my angle is that we don't record. We individually we practice a lot, and we see so many kinds of the patients, but we don't record it. We may see thousands and lakhs of the people in our hands, and we see that they are all healing, but we don't record them. But in the West, if the patients are only 10 or 15, they take in every angle, every depth of the scientific things, and they record it and they publish it in a bit bigger way. That is the only difference between that. And it's well-known statement that I treat and he cures. So it goes everywhere, every corner of the globe, including the East, West, North and South, with a different... Next slide, please. And the one most important thing, which is very, very important for all the healers, is the observation. So you may say that that may be about the consciousness at the different levels of consciousness, but one most important thing is the observation. So there is no more difficult art to acquire than the art of observation. And for some men, it is quite as difficult to record an observation in brief and plain language. And the physiology, histology, biochemistry and other things. But each and every part, each and every subject which is designed to learn allopathy has got its own philosophy and its own spirituality to understand about the human body. So if you know about in-depth of each and everything, and you will get one particular kind of holistic way of healing the human body, not only on the parameters of materialistic or the physical parameters where you are going to satisfy or make the criterion to say that the bone or the particular body is healed. Next slide. So in the last slide I said all the things, in the end I said about the energy sources. Now in the practice there are so many kinds of energy sources that are being used, branch of the medical practice, including the lasers, including so many energy sources. Why I put this slide is the human being is here, and there is a range of audibility and there is a range of thing where you can perceive, but there is a lot of range which is not going to be perceived by the eyes of the human being. Either it may be light, next slide, or it may be the sound. Even in the sound you have so many octaves where the human vocals can reach to the minimum level to the maximum level, but you can see the flute and other kinds of instruments which are going to be played, but still your soul and your spirit is going to enjoy that particular music without your intention, unconsciously. That means the range which is going to be seen by only human beings may not be the correct one, where because you have one side up and one side down. So that particular thing you have to understand at the time of healing. Next, wounds, but I don't go for it, but broadly I can speak about the wound is like the physical wound and as well as psychological or the mental wound. The physical wound is very painful, and if you just go the traumatic and as well as other things, wound is simply defined as the disruption of the surface epithelium. Whatever the continuity which is there, if that is disrupted, that is going to be defined as a wound. Whether it is a traumatic or if the patient is malignancy or the patient is having skin problem, cosmetic and other things, whatever that is disrupted either by the physics or by the mind, that is going to lead to the wound. So wound is nothing but the violation of the surface epithelium. Next slide please. So that may be the physical wound, and if you come to the psychological wound, it is usually by the society. If somebody says no, whatever you do it, and if somebody is attempting for the examination is failed or rejected, fighting, and of course somebody ignores that, excuse me and who are you? See, all those things leads to a kind of a psychological wound, which according to the psychology, it will be there at the grassroots level, at the conscious level, and that will reflect to the person's behavior, and that behavior may not be acceptable according to the norms, and he may become a psychiatric person, especially, and he may do a lot of harm to the society again. Next. But of course, whatever we study with so many books, with so many presentations, and of course so many publications, so much of recognition, still the person is standing there and is looking something else which is going to be to know about the wisdom of the life. So behind every eye there is a thinking that why it's happening like that. So if I take 3 to 4 patients of the same family with the same disease like appendicitis, if I operate the same patient, and all these 3 or 4 patients are going to heal in a different way. So that matters a lot of thinking, and that thinking will be always there. Why that happened? You can able to see that there is a microscope where the same ant is going to be seen with your eyes very small, and with the electronic system you can able to see in a large way. We cannot deny and we cannot simply say that these things are wrong. But these are the evidences which are going to be seen, and we have to believe that ant looks like this. Of course, the telescope, with the Hubble's telescope, the globe is appearing like a small dot in the galaxy. And with the microscope, the histology is showing a particular organ with the stains. The same surgery which is going to be opened can be more detailedly seen by the laparoscope. What I mean to say in this slide is this type of vision is very, very important to have the wisdom, to have the balance when you are treating a person, especially in my department. Next slide. Ultimately, each system has got one projection and one deficiency. So whatever the projection you are aiming at the disease, either physical or mental disease, which is going to have so many questions in the form of deficiencies. So if each system is going to fit together, I think the patient is going to have a lot of advantage, and they may have a very happy life altogether, and whatsoever the time that is given by the God. Next slide. So the conclusion is the healing is a dynamic process, and we should respect and recognize our inner signals regarding the disease or the health, and prevention is always better than the cure. And we should not miss the complete clinical examination whenever and whatever the system we are practicing for the patients. And we should do our best for the aiming of the healing, and we should have a nice integrated health practices. If I don't know anything about the healing and which is not happening, then there should not be any hesitation to refer the case to my colleague. Because ultimately the idea is to have a happy, healthy, productive society, and of course we should not forget our ethics. Next slide. Thank you for all. And thanks Google.com, because I have used many of the photos from the Google. And I am ready to answer if any queries.